Did you know that China has been documenting outbreaks of malaria for more than 2,000 years? The Zuli, one of the 6 classics of Chinese literature, contains records of malaria outbreaks dating back to the Zhong dynasty. Closer to our time, researchers investigating the chemistry behind traditional Chinese herbal remedies isolated a compound called artemisinin that proved extremely effective against malaria. The discovery has saved millions of lives and earned Professor Tu Youyou the 2015 Nobel Prize in Physiology or Medicine. Who discovered artemisinin? Malaria has never been completely eradicated, but until the 1960s, it was effectively treated by chloroquine and quinolines. These treatments helped limit malaria spread until Plasmodium falciparum, the deadliest parasite that causes malaria, developed drug-resistant mutations. Malaria-related deaths surged, especially in Southeast Asia. In 1967, the Chinese government launched an initiative to develop treatments for the new strain of malaria. For 2 years, researchers were unable to identify an effective medicine. Then they approached the Institute of Chinese Materia Medica, seeking new answers from traditional sources. Tu Youyou was a 37-year-old researcher at the institute. Trained in both Western and traditional Chinese medicine, she had studied pharmacology at Beijing Medical University, but also had extensive training in Chinese medical theory and practice. She was assigned to lead a new research team investigating treatments for malaria. Professor Tu spent 3 months collecting more than 2,000 traditional malaria treatments, some dating back to 770 BCE. She published her findings in a paper titled Anti-Malarial Collections of Recipes and Prescriptions. From this research, Professor Tu identified more than 100 herbs that seemed especially promising. She tested these herbs carefully for more than 2 years before demonstrating that plants in the Artemisia family showed some promise in treating malaria. These initial results were inconsistent and difficult to reproduce until she tried a method first published by Ge Hong nearly 3,000 years ago. Most herbal extractions are boiled. Ge Hong recommended immersing Artemisia herbs in unheated water and wringing their leaves to extract their juice. Unheated water, Professor Tu guessed, might allow her to extract more highly concentrated antimalarial substances than previous methods had allowed. This approach proved successful, and Professor Tu also discovered that one variety of the herb, Artemisia annua, was especially effective. In late 1971, her team produced an Artemisia annua extract that proved 100% successful in treating malaria in rodents. Professor Tu was also able to isolate artemisinin, the compound responsible for Artemisia's malaria-fighting properties. Facilities around China sprang to action, extracting large quantities of artemisinin and studying its composition. The Chinese Ministry of Health approved artemisinin in 1986 and a variant, dihydroartemisinin, in 1995. Artemisinin's continuing impact. From 2000 to 2012, worldwide incidents of malaria were reduced by 25%, and deaths caused by malaria were down by 42%. A growing number of countries declared themselves to be on track to rid themselves completely of malaria. Artemisinin was an important part of this decline. Researchers estimate that artemisinin combination therapies were responsible for roughly 22% of the 663 million cases of malaria that were averted between 2000 and 2012. Since then, research into artemisinin has produced a new class of antimalarial treatments. The 1,2,4-trioxane pharmacophore contains a peroxide group that is especially damaging to malaria parasites. This discovery led to the development of synthetic peroxides such as OZ277 and OZ439 that represent the future of our efforts to combat malaria. Research continues on the medicinal properties of artemisinin. Building on Tu Youyou's groundbreaking efforts, scientists have begun to investigate artemisinin's potential as an antiviral and anti-cancer agent.